rise today as a mother, as a woman, and as a representative to offer this straightforward amendment to protect women's access to vital health care. Contrary to what many Americans have been led to believe, the bill before us today is not about abortion. This bill would, however, restrict women's access to health care all across the country by eliminating all federal funding for Planned Parenthood. Let's be very clear. No federal tax dollars go towards abortion, and none have since 1976. That is not what this bill is about. We all know a woman who has been diagnosed with cancer, cervical cancer, breast cancer, ovarian cancer. It may be your mother, your neighbor, your wife, who sought preventive care or cancer screening from a doctor of her choice. And yes, we all know a woman who has received quality medical care at Planned Parenthood. In fact, 1 in 5 American women has sought medical care from Planned Parenthood. It may be your daughter. It may be your boss. It may be your colleague. My amendment will ensure that any qualified organization that provides women's health services can receive funding. It's simple and it's fair. We need more access to quality health care, not less. We need to stop trying to restrict access to life-saving cancer screenings, birth control, and well-woman exams. We need to stop fighting 40-year-old battles on women's rights. Defunding Planned Parenthood would have a devastating impact on women, especially low-income women, women in rural communities, and women of color. And it's not only women who receive health care at Planned Parenthood. Men receive health care at Planned Parenthood, too. Here are some facts about Planned Parenthood's critical role in providing health services to Americans every year. Planned Parenthood provides family planning, counseling, and contraceptive care to 2.1 million Americans, more than 1.1 million pregnancy tests, nearly 400,000 pap smear tests, nearly 500,000 life-saving breast exams. And let's remember that in many areas, Planned Parenthood is the only source of family planning services. That's why in 1976, as a college freshman, I volunteered for Planned Parenthood, because I had seen the impact on young women in my rural high school who had no access to family planning services. Too many got pregnant, dropped out of school, and never pursued their dreams. Today, with only 5 legislative days left, we should be focusing on avoiding a reckless and unnecessary government shutdown. Do you remember the last government shutdown? The one that cost us $24 billion. No wonder some don't think America is great right now. Dysfunction in this Congress is undermining the American people's faith in democracy. But we in Congress have the power to act. We have the opportunity and we have the duty to set aside ideological battles, instead to take up the urgent business of the American people. We should authorize the Export-Import Bank and pass a long-term, well-funded highway trust fund bill, investing in America's infrastructure to ensure that America will continue to be great throughout the 21st century. I urge my colleagues to support my amendment to ensure that American women have access to vital health care, no matter where they live and no matter how much they earn. Thank you, and I yield back the balance of my time.